afternoon, everyone. This is Kevin at the Kingsport Senior Center. Today's wellness seminar is going to be on inpatient rehab. And I've got my good friend here, Debbie Cook, who is a rehab liaison with Encompass Health and Rehab Hospital. She's going to do a great program today, which I hope everyone enjoys. Go ahead, Debbie.
Thank you very much, Kevin, for the opportunity. And just bear with me. We'll get through these slides. We shouldn't be any longer than about 10 to 15 minutes. Kevin limited me. He said I've got to do it quick. So it won't be a long presentation, and I hope you won't get bored. But as Kevin said, my name is Debbie Cook, and I'm from Encompass Health and Rehab Hospital here in Kingsport. We have our hospital here in Kingsport. We also have one in Bristol, Virginia, and Quillen Rehab in Johnson City is also an Encompass facility. So you have three choices. Sometimes if one gets full and we can't get patients in, we can always send them to one of the other two places, depending upon what the patient wants to do. So I'm sure that what is inpatient rehab and why is inpatient, why you need inpatient rehab and what inpatient rehab is all about. So I just want to let you know too that at the end of this, if you have any questions, if you want to funnel those to Kevin afterwards, he can get those questions to me and we can get answers for you if you have any questions. So we'll get started. And so why inpatient rehab? I know that when you need rehab, what you want to do is make your best choice, and that is where you're going to receive your rehab, because that's very important to your recovery and reaching your best possible outcome. And that's what inpatient rehab is all about, getting you to your most possible outcome and achieving what you want to achieve to get back to your previous level of function based on what injury you have sustained. And at Encompass Rehab, it's care that's focused on you. And as I've said, that right rehab program can make a difference in how quickly you will return to your home, to your community, to your family, and to the things that you love after an illness, an injury, or any type of surgery that's caused you to be in the hospital. And sometimes if you go home after you've been in the hospital and you may have had the opportunity to do inpatient rehab, but you opted not to. Once you get home, you may realize that inpatient rehab was something you really should have considered. So, but we can still get you admitted. We can do home admissions from your home to inpatient rehab. You do have to have, at that point in time, you will have to have your physician refer you to us, but usually that's never a problem. So what you can achieve is your ability to function independently, and that's the main goal of Encompass Health and Rehab Hospital. And just so you know, Encompass is accredited by the Joint Commission to provide medical and therapeutic services. And we also have really advanced technologies. We have the experience and the knowledge of our physicians, the nurses, the therapists, the pharmacists, and Encompass Health will help to ensure that you do reach your best possible outcome, which is what we want, and absolutely that's what you want as well. So when you're considering rehab, there are some differences as opposed to a skilled nursing facility or a nursing home versus inpatient rehab. And as you can see there, one of the main differences is average length of stay at inpatient rehab, like Encompass, is around 13 days versus the average length of stay at a skilled nursing facility or nursing home is around 30 days. And most of the patients who are discharged to home, that's around 81% versus 45% at a nursing home. And if you look at the requirements for a inpatient rehab hospital, you have to satisfy certain regulatory policies and requirements for hospitals, and that includes your Medicare hospital conditions of participation. Also, patients must be admitted by a rehab physician. and the rehab physicians must reconfirm each admission so that they see that patient within 24 hours that they're admitted. And all patients, regardless of their diagnosis or their condition, must demonstrate that they have a need to be and require 3 hours of physical therapy a day while they're there. And as you can see on the other side for the nursing homes or the SNFs, they don't have those requirements. So you're getting better care. They're looking at you in a different way when you're in inpatient rehab. They're making sure that you're getting the care that is designed especially for you. And as we mentioned, you have 3 hours of therapy a day, usually 5 days a week, sometimes more. While you're there, and if you're not in therapy, they don't let you lay in your bed throughout the day. They make sure that you can sit up in your chair and that you're moving as much as possible, just so you can get back to your prior level of function. And that's the whole purpose of inpatient rehab, to get you back to the level of functioning that you were prior to your injury or illness or fracture or stroke. Also, some more differences, as you can see, rehab hospitals are required to provide 24 hours, 7 days a week nursing care. And many of the nurses are RNs and rehab nurses. That's not the situation in a nursing home or skilled nursing facility. Also, rehab hospitals have an interdisciplinary team, meaning that they have the physician, the nurses, the therapist, the pharmacist, everybody that's needed to take care of you. And that's not no similar requirement is in the nursing home or a SNF. And they have to have, at rehab hospitals, to follow stringent admission and policies and clearly document the justification for each admission. So that's not a requirement for a nursing home or a SNF. So as you can see, there are some very significant differences. So just be aware of those when somebody mentions to you, do you want to go to inpatient rehab? Your answer should be absolutely you want to. An Encompass inpatient rehab program is a very comprehensive program. As we said, provides a minimum of 3 hours of skilled therapy at least 5 days a week. And that's occupational therapy and physical therapy. And if the patient needs it, they can get speech therapy. Physicians have specialized training and experience that provide the admission approval and the assessment or oversight of the patient. And the physician provides face-to-face visits with the patient at least 3 times a week. So you are actually seeing a physician 3 times a week. The inpatient rehab program also makes sure that they document your level of treatment, any type of interventions that you have, and that's done daily. And all the outcomes are documented as you progress through your treatment plan. And the team meets weekly to talk about the patient, or to talk about you, and how you're progressing with your particular type of therapy. If you need any changes to your therapy, what you're going to need when you go home, and if your family will also be involved in that. They set up family meetings to come in and talk with the therapist, to talk with the physician, so that you will know what you're going to achieve and what you will need once you're discharged when you go home. And there's also, as I said earlier, pharmacy and diagnostic services are also available at the facility. You get skilled rehab nurses who are CRRNs, and CRRN, that means a certified rehab registered nurse, and they're there on site 24/7 taking care of you. We'll get more into that CRRN in just a minute and why that's important. But your pre-admission screening will be completed by a rehab professional. When you come in, they'll sit you down and talk to you and screen you, and you'll give them what your goals and what you want to achieve, and then they will develop a treatment plan that is designated specifically for you, the patient, and they'll make sure that they understand what your goal is and make your plan in accordance to help you achieve that goal, and make sure that when you leave, you have reached your goal that you set out and you wanted to achieve prior to coming to rehab. So back to the CRRN and why that's important. As I said, it's a certified rehab registered nurse, and that is a registered nurse who has gone above and beyond her specific training and become additionally trained in rehab nursing. So that is very important because, as you can see, for every 6% increase in the CRRNs that's in a rehab hospital, the length of stay at that hospital is decreased by 1 day. And of course, that's a difference that's always in favor of the patient. And these CRNs, they're more confident in their rehab efforts, and they can handle all aspects of your care with a high sense of responsibility. And this quality, along with enhanced skills as a rehab nurse, helps the nurses provide a more targeted path that leads to patients returning home faster, getting back to their family, getting back to their community, and getting back to the activity level that they hope to achieve. So here's some of the diagnoses that qualify for admission to rehab. As you can see, number 1 up there is stroke, and a lot of people, as we get older, sometimes, and it does happen to younger people as well, but strokes are one of the most important things that we are qualified to do at rehab. We are certified by Joint Commission and the American Heart Association for stroke rehab, and not everybody has that qualification. So if you have a stroke and you're coming to us, you know you're going to get the highest level of stroke rehab to get back to your prior level of function. And as you can see, spinal cord injuries, fractured hips, any type of joint replacement, any type of neurological disorders, just to name a few. But you can see some of the qualifying conditions that we use to get patients admitted once they're discharged from the hospital, or as I said, we can get patients admitted from home. And just a few facts. We were talking about strokes and how important it is to get the correct rehab for strokes. And these are just some stroke statistics. You can see that strokes kill about 140,000 Americans every year, and that's 1 out of every 20 deaths. And someone in the United States has a stroke every 40 seconds. So that's a large amount of strokes. Every 4 minutes, someone dies of stroke. And every year, almost 800,000 people have a stroke. So strokes are very, they're out there. Anybody can have a stroke, and you don't know when you want to have a stroke. But it's important to have the right rehab at a certified stroke rehab facility to make sure that you can get back to a functioning level. And as I said earlier, the American Heart Association and the American Stroke Association favor inpatient rehab, which is what Encompass is, and suggest that stroke survivors should receive care in inpatient rehab in preference to skilled nursing facilities or nursing homes. And Encompass Health and Rehab is one of the nation's leading inpatient rehab providers. It offers a high level of stroke care with intensive, as we mentioned, multidisciplinary treatments that help patients get back into their community and get back home and to their families as soon as they possibly can. So when you're coming to Encompass Rehab for therapy after a stroke, after an illness, after a surgery, after a fractured hip, what we do is, whatever your insurance might be, we'll get a prior authorization to make sure that your insurance is going to pay for inpatient rehab. And based on your level of inability to function, most insurances do pay for inpatient rehab. But we will know that in advance because, as I said, we do prior authorization for that. So, so remember, we've talked about making the right choice for rehab and how important that is. And there are so many advantages to choosing Encompass Rehab Hospital. We've mentioned quite quite a few of those today. And there are other facilities that offer similar services, but the quality, and as we've talked about, the expertise and the level of comprehensive care will vary significantly. So Encompass Rehab Hospital in Kingsport, we're always here. We're ready and willing to help you with the process of choosing your rehab. And if you want, you can come by for a tour at any time. Come by and tour the facility, see what it looks like. You can bring your family, and once they see it, I'm sure that you're going to realize the advanced technologies that we have to help you to get back to your level of functioning and get back to your community and get back to your family. So I really appreciate Kevin having me here today and allowing me to bring this information to you. If you have any questions, as I said earlier, please send those to Kevin. He'll get those questions to me, and I will definitely get you answers. As you can see, the 423-246-1972 is the number for Encompass. My number, if you have a question, is 423-268-0673. Feel free to call me at any time. And again, my name is Debbie Cook. If you have any questions, please feel free to call me. I appreciate your time, and thank you so much.